Like and subscribe and click the bell icon to get new video updates.
National Cabinet meets for the first time since Anthony Albanese became Prime Minister. Health, worker shortages and the cost of living are on the agenda. Australia's biggest health crisis saw the creation of National Cabinet, and more than 2 years on, health remains front and centre as the group meets for the first time since Anthony Albanese became Prime Minister. The state and territory leaders want health funding consistency and an improvement in primary care to reduce the number of people in hospitals. During the height of the pandemic, the then Morrison government increased Commonwealth funding to public hospitals to a 50-50 split, but that is due to expire in September, and all the state and territory leaders want that extended. Victorian Premier Daniel Andrews said the government must not proceed with Scott Morrison's cutbacks. All we want is some time. We want to buy some time to do some really important work, whether that is 3 months, 6 months, whatever it might be. We can proceed in September to cut health funding at a national level. That just doesn't make any sense, he said. States are ramping up the pressure on the major parties to pledge billions extra in public hospital funding to ensure patients across the country get the care they need. Read more. Victoria, along with a number of other states and territories, has also raised concerns about the number of Australians that are using the emergency department as a first resort for care. South Australia's Premier Peter Malinauskas said some hospitals are overcrowded because primary care has not been managed properly, and the problem is across multiple states. This challenge isn't just about the money. What we also have to confront as a nation is what are we doing to manage demand, he said. There are a lot of people in hospital emergency departments that quite frankly don't need to be there. They are coming from the aged care system, or they are not getting access to the GP. If someone is in a hospital because they couldn't get access to a GP, we have a problem with healthcare service delivery that is out of the control of the states. Space to play or pause, M to mute, left and right arrows to seek, up and down arrows for volume. A spokesman for Queensland Premier Annastacia Palaszczuk said they have hundreds of older people and people with a disability that should be receiving care outside the hospital system. These people are not sick, they have no one to care for them. That is creating problems down the line, the spokesman said. While health is a priority for the states and territories, the leaders are very aware they will not walk away with a magic solution at the end of today's meeting. Prime Minister Anthony Albanese yesterday talked down the prospect of committing to additional funding. We inherited $1 trillion of debt with not much to show for it, he said. That is the context in which we will consider discussions going forward. We are not in a position to do everything we would like to do immediately. Mr Albanese pointed to the government's promise to fund new GP clinics that aim to take the pressure off hospital emergency departments in an attempt to boost primary health care support. Worker shortages. To contend with, the Prime Minister has indicated that today's meeting will cover a range of issues, including ways to reduce cost of living pressures. Read more. I want productivity to be front and centre of that agenda, and I will be discussing that, as well as no doubt we will have a discussion about energy as well, he said. There have been nearly daily meetings of energy ministers who have talked through the East Coast power crisis, and it is expected that today's meeting between state and territory leaders will focus on issues other than power. One of those is migration and skills shortages. New South Wales, Queensland and Victoria have signalled their intentions to discuss workforce problems. Businesses have repeatedly raised concerns about the difficulties in finding qualified staff, and some have called for changes to make it easier to hire skilled workers from overseas. The Northern Territory, on the other hand, wants to discuss projects in energy, critical minerals and manufacturing, as well as workforce needs. How will National Cabinet work under Albanese? While there are unlikely to be any major announcements on the health, energy or jobs front, the group is expected to try and determine how National Cabinet will work in the months and years ahead. Experts say the state's brown coal reserves could provide a safety net, but aging power plants and instability from the interconnected national energy market may still pose a threat. Read more. Mr Albanese has said he wants to make changes to how the group operates. I will work those things through cooperatively. I want to see how we can involve local government. I will discuss that with them, and I will discuss the way that we progress into the future. He